Coronavirus cases across America's Sun Belt are surging. In Florida, more than 140,000 residents have now tested positive for the virus. The state recorded more than 9,500 new cases on Saturday alone. Bars and restaurants that had reopened are being forced to close for a second time. And on Sunday, Governor Ron DeSantis, who for weeks tried to downplay the threat of the virus, attributed the recent surge in cases to young people.
And if you look at that 25 to 34 age group, that is now by far the leading age group for positive tests in the state of Florida.
The governor has also blamed the state's, quote, overwhelmingly Hispanic farm workers as a source of the virus.
If you look at the counties that have 10% or more positivity, it's almost always has agriculture links or prison or jail links.
But for months, the rural community of Immokalee has been trying to raise the alarm with the governor's office. Immokalee is home to thousands of migrant farm workers. Some are undocumented or on temporary guest worker visas. But during the coronavirus outbreak, they've been deemed essential. Now, the Immokalee zip code 34142 has the highest number of cases of any zip code in the state of Florida.
The people that place the food on the table of every family deserves better.
I'm Tremaine Lee, and this is Into America. Today, we're going into Immokalee, known as America's tomato capital, on the eastern side of Collier County in southwest Florida. Collier County is also home to wealthy Florida enclaves like Naples and Marco Island. I sat down with representatives from the Coalition of Immokalee Workers, a farm worker advocacy group. The CIW runs the Fair Food Program to ensure good wages and working conditions on the farms it partners with in Florida and other states. And they say this crisis not only threatens the nation's food supply, it threatens the lives of millions of farm workers all across the country. Greg Aspen co-founded the Coalition of Immokalee Workers in 1993. Gerardo Reyes Chavez is a leader in CIW. He also spent many years as a farm worker in Mexico and Florida, starting when he was 11. Greg, Gerardo, thank you so much for joining me. I really appreciate it.
Thank you.
Thank you. Thank you for making this possible.
So, Gerardo, I want to start with you. I hear you've been doing this work for a long time, farm work. How did you first get into farm work?
My family has worked in the fields. That's where I grew up. When I was 11 years old, during each weekend, there was no vacation time. That's what we did.
You know, for a lot of people, it's as if the food in the grocery store and the fresh fruits and vegetables just kind of fall from the sky, right? They just wake up and there it is. But it takes a lot of hard work. For the average worker, working in Immokalee and other places around the country, what is a typical day actually like?
Well, you wake up at 3:30, 4 a.m., start walking to a parking lot in the center of town, and then you are picked up. There's a couple of spots in Immokalee where you get picked up by these buses that takes you to the fields around Immokalee, and then depending on when in the season, that extends from November to May, you go to the fields also in Central Florida. These companies based in Florida also produce in other states. So you follow the season during the summer. You used to, before the Fair Food Program, we used to wake up and go to work from 10 to sometimes 12 hours a day. You come back to your living quarters, which are typically a mobile home where you live with 8, 10, 12 people. In order to save rent, you are transported in repurposed school buses, and you travel all overcrowded to the fields. And during the day, you have to endure a lot of abuses, a lot of yelling, a lot of discrimination. in a single day, a farm worker has to pick more than two tons of tomatoes. So you can imagine makes for a very, very vulnerable community. Before you even complain, before you even try to address an issue of abuse against you, you have to think about, am I willing to risk the food on the table for my kids?
So what happened when coronavirus collided with that? How have workers been impacted? And when it comes to workers that you've worked with, have any of them gotten coronavirus?
Yeah. Well, it is the perfect recipe for disaster when coupled with the lack of appropriate response from those who should be, responding with the resources that are needed in communities like Immokalee. And in general, rural communities that are that were deemed essential for the work they do, we're seeing how it is especially dangerous when we are talking about a unwilling government that is not doing its part, that is arriving late even to do something that is not even appropriate right now.
Greg, you've been organizing for a really long time, man. And when you saw COVID-19 creeping in and you understand the workers, their conditions, you understand step by step, what are the inherent risks to this community and this population? And when you first started seeing coronavirus coming, did you say, this is going to be bad? Did you realize it immediately?
Oh, for sure. And we knew that the conditions in the housing, the conditions in the transportation where people get driven to work in employer-provided transportation in vans, 15 people in a van or 40, 50 people in a bus, that those were the perfect superconductor for the spread of this virus. So early on, we started, toward the end of March, we wrote to the governor directly. We didn't make it public. We just wrote to him and said, this is going to be a problem. Farm worker communities like Immokalee are going to be facing a massive and uncontrollable spread of this virus once it gets a foothold in our communities. And you need to step up now because it's such a high-risk situation and bring resources to help protect the community. And, it took some time for what we said to happen, but it did. And right now in Florida, which is an epicenter, we're the epicenter of the epicenter. We are now the zip code with the highest number of positive cases in the entire state of Florida.
The coalition came together with 49 other organizations and wrote this letter to Governor DeSantis and laid out a bunch of orders. Give me a rundown of what you were asking for and also what the response was from the governor.
Well, what we have been asking for since the beginning, we started with testing. We were also asking for the governor to work with us, basically, in trying to imagine a field hospital. Because remember, we're talking about a community that's like 40 minutes away, lacks transportation, and it's living under really overcrowded circumstances. There's no way that everyone can make it to a hospital being so far away. And or a place that was dedicated for people to self-isolate if they tested positive but were asymptomatic. While at the same time, we were asking for the follow-up steps that come after that, the contact tracing, to make sure that you identify everyone who's positive so that you can then direct the resources to treat those who start to show symptoms while at the same time try to contain the spread. We were asking for that. We were also asking for the resources that makes it possible for workers that are poor, So you get sick, you don't have any kind of income, you don't have any kind of support either.
What was the government's response?
That's the problem. It was very slow to respond. For quite some time, they did nothing. In the end, we had to actually connect ourselves directly with Doctors Without Borders, a non-government organization that is, it's a Nobel Prize-winning organization for its health work overseas. It doesn't work in the United States. And so they actually came before the local health department came and started doing testing. And that was, I guess, the thing that sparked them to actually step up. So at the end of May 3rd is when they started testing, and they did that for 3 days. But then they didn't do it again until May 31st.
I think that in about a month, they get 163 tests. That was it for our community for about a month. Well, in other places, we heard how, or the hospital in Naples, about how they had always have access to those tests. And when you see the fact that, you need to fight, actually. That's ridiculous to me. You need to fight so that you can have access to something that will protect you as a community. And we had to actually make the argument that the food supply was in jeopardy. We even had to leave behind the importance of us as human beings and trying to protect our lives. We had to make the point that the food supply of the country was in jeopardy, which is also true, but it's a shameful approach when we are trying to work together to slow the spread of a virus that represents a threat to the life of everyone.
We'll be right back. I'm back with Greg Aspen and Gerardo Reyes Chavez from the farm worker advocacy group, the Coalition of Immokalee Workers. When people hear Doctors Without Borders, you're thinking of a poor country, an earthquake happens, they don't have the infrastructure or the wealth. What is it about this community that the state and officials decided to just ignore?
People who are charged with protecting the community of Immokalee for public health have very little in common with the community of Immokalee, demographically, geographically, economically, while the other communities that they are also charged to protect, the coastal communities of Naples and Marco Island and Bonita Springs, they do have a lot in common with them. It's interesting. We have the Fair Food Program that Gerardo mentioned. And in that program, there's a dozen major growers who provide tomatoes and other fruits and vegetables for the country. And, they did things like they went out and they bought groceries for everybody so that people didn't have to go on individual trips to the grocery store and, exponentially expand the possibility of exposure. They went out and got those groceries paid for them. These are growers that did that, while our state wouldn't even think about providing sick leave support for workers who don't have it. So what happens when you don't have sick leave? You don't go get tested because you don't want to find out. First of all, you can't take the day off. Second, to get tested. Second of all, if you are tested and you're tested positive, you're going to be sidelined for 2 weeks, 3 weeks. And people can't afford to do that. So people don't go get tested because they don't have sick leave. And yet here the growers are putting out resources to help the workers get through this very difficult time that the county and the state didn't even think once about doing. That's how absurd the response was.
And also, if I may add, something that doesn't help at all, it's what's going on in the public sphere. And you see the response from Governor Ron DeSantis. You don't want to be mixing those people with the general public if there is an outbreak. When you hear things like that basically it's embracing the idea that it is okay to let farm workers alone without resources, and basically if they die, it's kind of accepted. We cannot accept something like that as a community. But beyond that, the country shouldn't allow. The people that place the food on the table of every family deserves better.
So Greg, here we are. That letter was sent almost 3 months ago. What's the status of things now? PPE, the testing, the contact tracing, everything. Where are we now?
Testing has, I wouldn't say caught up to the problem, but it has definitely made some progress. The fact that Immokalee has become the number one zip code in Florida shows you they've gotten their arms around the problem to a certain extent, far better than the past. So now we know the problem, right? But testing doesn't do anything in and of itself. Then you need the contact tracing and the isolation support. But those things are not forthcoming. And even though we have now a partnership with a group called Partners in Health, another internationally respected expert in health services, but also probably the national expert on contact tracing. They have come to work with us just like Doctors Without Borders did. Again, 2 international organizations to deal with refugees overseas coming to Florida to do this. Their particular expertise is contact tracing. And the county is not accepting their support to do contact tracing free in Florida.
So Greg says that there were offers of outside help, but they were rejected. We reached out to the Florida Department of Health in Collier County for their response. Public Information Officer Christine Hollingsworth says she was not aware of any offer of help from Partners in Health to do contact tracing for free in Florida, and that mass testing in the county was made available in Immokalee first at the beginning of May, and that isolation resources were available in Immokalee at the end of May, beginning of June. Hollingsworth told us, quote, "The mission of the Department of Health is to care for the health and well-being of all of our residents. It doesn't matter if you live in a $40 million mansion on Gulf Shore Boulevard or if you pay $40 a week in rent in Immokalee. We are going to care for you." So, Greg, we're seeing that the spread of coronavirus is far from over. In the South and the West, numbers are rising. And as we see growing seasons and harvesting seasons upon us, is there concern that if we don't address what's happening in places like Immokalee, that this will continue to spread and even at a greater rate, even worse?
Oh, absolutely. And there's no question about that. People left Immokalee because the season ended here and went up the eastern seaboard for the northern summer season. And what percentage of those people went with, an active infection? We don't know, but certainly not zero. There's a significant number of people who left who were infected. Housing conditions up north are even worse for workers than they are down here because it's more temporary. People are in these places up north for about a month, right? So in some places, you may be staying in one of those very cheap hotels that you see on the side of the road sometimes. Anything that happens, any person who gets sick in that room is absolutely going to share that virus with every single buddy else. So those conditions that we see in Immokalee today are going to be as bad or worse up the road.
And this should also, if I may add, this should also be a wake-up call for governors in other states. Because remember, workers live here during these 8 to 9 months of the year. Around May, you finish the season, you travel up north. But there's also workers that go into other states to do other crops that are not necessarily with companies that are based here. Many Fair Food Program farms have implemented best practices to protect workers, like taking temperature, requiring mask wearing on buses, disinfecting transportation several times a day, and making sure that people are not overcrowded while they are going to the areas for lunch. Here we have a chance because we have a willing tomato industry that is working with us. But in other places, that's going to be even worse. It is even worse right now as we speak.
Let's talk about what's at stake just to the food chain, the supply chain, right? Let's talk about what's the risks we're taking in the big picture here.
Well, the big picture here, it's that the food supply is at risk. If people don't think that our lives are as important, they should start thinking about their own well-being. A food crisis is coming on top of a pandemic, and that is impacting already a lot of people. There's a lot of plants that have been closed, and if we continue at this rate, there's not going to be people to harvest the food. In order to be able to fight this in a proper way, we all need to do it together.
Greg, Gerardo, thank you so very much for your time. We really do appreciate it.
Thank you very much. It was great. Good talking to you.
Yeah, thank you.
That was Greg Aspen and Gerardo Reyes Chavez of the Coalition of Immokalee Workers. We also reached out to the office of Florida Governor Ron DeSantis, but we didn't hear back. Into America is produced by Isabel Angel, Allison Bailey, Aaron Dalton, Max Jacobs, Barbara Rabb, Claire Tsai, Aisha Turner, and Preeti Varathan. Original music by Hannes Brown. Our executive producer is Ellen Frankman. Steve Lichtai is executive producer of audio. I'm Tremaine Lee. We'll be back on Wednesday and again on Thursday.